think one of your bills is on consent, so we'll just hear item number 12, SB 762. Welcome.
Thank you. I'm happy to have this on consent, too, if you want to. Madam Chair, members, thank you for starting so promptly. This is SB 762, and it arises from a court decision that has caused some concern to the medical community of California. This bill is streamlined to pertain only to the healing arts, and it allows the city of West Hollywood to grandfather in its existing ordinance. But basically what the problem is that a precedent had been set where local government can set its own health standards apart from the rest of the state. And most of us in the medical community really see that as a function of the legislature, that we can't have a patchwork quilt of medical standards and procedures varying from city to city or county to county. You could have a board of supervisors where the majority opposed the Gardasil vaccinations and could ban that vaccination in that county. You could have a city council which feels strongly against contraception, doing bans on surgical sterilization, etc. And so I see this as a function of the state legislature and the Department of Consumer Affairs and its regulatory boards. And I think that we should answer the court precedent by enacting this bill, which sets a statewide standard. With me I have Tim Shannon, and I also have Mike Dillon representing the California Veterinary Association. This bill is also sponsored by the Dental Association, the Optometrists of California, and Marriage and Family Therapists.
Thank you. Welcome.
Thank you, Madam Chair and members. I'll be brief. Mike Dillon, representing the California Veterinary Medical Association. Mr. Hill is new to the committee this year, but this is a more narrow version of Mr. Ng's bill from last year. As that bill left this committee, it applied to all the professions, contractors, architects, and so forth. On the Senate side, we amended it down just to the health professions and specifically just to the scope of practice. We also tried to address issues raised by the League of Cities, and SB 762 includes that language. And then, as Senator Anistad mentioned, Mr. Ng is not here, but he made a promise to the mayor of West Hollywood to grandfather them in, so they have been grandfathered in. And lastly, Madam Chair and members, is the support letter from the Veterinary Medical Association states, to paraphrase, a patchwork of local ordinances would cause major confusion to both licensees and consumers and cause confusion in the application of laws in the board's inspection and enforcement program. So we're in strong support, Madam Chair and members.
Madam Chair and members, Tim Shannon representing the California Association of Marriage and Family Therapists. As the sponsor notes, this is a much narrower bill than the bill that you approved last session. We appeared at that time in support of Mr. Ng's bill and pointed out that it's really the province of the legislature to decide what the scope of practice is of the people that it regulates. So we're in strong support of this bill and urge an aye vote.
Thank you. Any other witnesses in support?
Good morning, Madam Chair and members. I'm Fred Noteware, representing the California Dental Association in support. Thank you.
Thank you. Any other witnesses in support? Witnesses in opposition?
Good morning, Chairwoman Hayashi and committee members, and thank you for this opportunity to speak to you today. I am Dr. Barbara Hodges, a licensed California veterinarian. Today, I speak for the Humane Society Veterinary Medical Association, a professional organization representing hundreds of California veterinarians dedicated to the health and welfare of all animals. We oppose SB 762 because it would prevent our local communities from crafting and implementing certain essential animal protection regulations. Veterinarians are distinct from other health professionals in that our patients are animals, and as animals, they are still considered to be personal property. Our patients have no civil rights of their own. Because animals cannot speak for themselves, our patients cannot consent to their own medical procedures. Pet owners can still legally request that potentially painful, risky, and unnecessary medical procedures be performed on their pets purely for their own human convenience. Thus, under the law, these animals have neither literal nor figurative voices. Instead, it is often anti-cruelty regulations that protect them from unnecessary harm and suffering. Consensus about what constitutes acceptable treatment of animals may vary from community to community. We believe it is important that communities retain their powers to set standards for humane animal treatment within their own borders. In 2007, a California court, in upholding a ban on feline declawing, found that local prohibitions against non-therapeutic procedures are legal and are, and I quote, not regulation of the practice of veterinary medicine, unquote. The decision preserves the imperative of medical judgment and does not invite intrusion into healthcare practice. It is critical that local anti-cruelty regulations remain applicable to the broad spectrum of animal health care practitioners. We urge your opposition to SB 762. Thank you.
Next witness.
Thank you. My name is Dr. James Jenswold. I'm an oral and maxillofacial surgeon. I'm a member of the California Dental Association, but I'm here primarily as a member of the California Animal Association. The portion of this bill that we object to is just that portion that interferes with the city's ability to handle issues of animal cruelty. I would like to ask the committee members to look at the 2007 appellate court decision that was the impetus for this bill. A lot has been said as to the necessity for this bill, but the judge was very specific that what was allowed was a city's ability to pass restrictions on non-therapeutic, non-curative procedures that provided no benefit for an animal, and because they are non-therapeutic, are incidental to the practice of veterinary medicine. So the court ruled that this was not regulation of veterinary medicine. There's a long history of local government affording protections for animals. Animals have, as Dr. Hodges says, they are property. They have no rights. There's no constitutional guarantees for them. They're reliant upon human beings to pass anti-cruelty laws, and we think this will harm the ability for local governments to pass those. We urge that you vote no on SB 762. Thanks.
Thank you. Any other witnesses in opposition?
I'm Barbara.
Oh, I'm sorry. Go ahead.
No, you go ahead.
Ignacio Hernandez, also on behalf of the California Animal Association. We do want you to look at whether or not this bill would prohibit local governments from adopting and enforcing animal cruelty laws. We think that it does. We would ask for an amendment simply to make clear that local governments can continue to enforce animal cruelty laws. Most of your cities and counties have the animal cruelty laws on the books. If it's generally applicable to the general population and it happens to impact veterinarians, then so be it. In the court case, it said that that's okay. So we really ask you to look at that amendment.
Thank you. Next witness.
I'm Barbara Schmitz on behalf of Born Free USA, and we're in opposition.
Thank you. Any other witnesses in opposition? We actually have a quorum, so we're going to please call the roll. We're going to establish a quorum.
Hayashi.
Present.
Emerson.
Present.
Conway. Here. Ng. Hernandez. Nava. Nilo. John Perez. Ruskin. Smythe. Hill.
We have a quorum, and also welcome to our member, new member today, Mr. Jerry Hill. Thanks for joining us. Are there any questions from the members? Hearing none, would you like to close?
Yeah, Madam Chair, members, this bill does not. All three of the members in opposition who spoke used the word cruelty. This bill does not prohibit local governments from making anti-cruelty laws. What it prohibits is the local governments from setting the standard of health care and to say that a veterinary procedure done properly with accepted techniques as taught in a veterinary school of medicine, to call that a cruel procedure, I think, is a real disservice to the veterinarians who take care of these patients. I would request an aye vote, and we'll leave it at that.
Move the bill.
Thank you. This is an important bill, and I think it is appropriate. The legislature does set standards for medical communities, so I'm going to recommend an aye vote. Thank you. Please call the roll. Wow, no, we need a second.
A second.
Thank you.
Motion is due pass. Hayashi?
Aye.
Hayashi, aye. Emerson?
Aye.
Emerson, aye. Conway? Conway, aye. Ing? Hernandez? Hernandez, aye. Nava? Nilo? John Perez? Ruskin? Ruskin, aye. Smythe? Hill? Hill, aye.
Your measure's out.
Thank you, Madam Chair and members.
Thank you for your time.
Senator Correa, welcome to your old committee. We're going to take up item number 1, SB 33,
Madam
and
Chair.
item number 9, SB 549. Which one would you like to do first?
Let's start with the marriage and family.
Great. You open on your measure.
Thank you, Madam Chair and members. This bill revises the qualifications and educational requirements for licensure as a marriage and family therapist in California. These changes in required curriculum will only be effective to those that began their graduate study on or after August 1st, 2012. This is a bill that's sponsored by the industry. In the background, essentially, the industry recognizes that society has changed, and therefore additional preparation requirement is now deemed necessary.
Thank you. Witnesses in support?
Paul Riches with the Board of Behavioral Sciences. We're the sponsor of the bill, and this is the product of about a 1.5-year long project we undertook with agencies and students and educators and practitioners in California to bring the educational requirements up to standard for practice in the 21st century. We'd ask for your aye vote.
Thank you.
Madam Chair, members, once again, Tim Shannon on behalf of the California Association of Marriage and Family Therapists. We're also in support of this bill that updates the educational standards. I'm going to just hand it over for a second to our Executive Director, Mary Remersma.
Mary Remersma, California Association of Marriage and Family Therapists. We are very much in support of the bill. The bill is good for the profession. It's good for consumers. It's good for the agencies where marriage and family therapists work. And we certainly encourage your support. We'd be happy to answer any questions you might have.
Thank you.
Good morning, Madam Chair, members. I'm Fred Notwer, representing the American Association for Marriage and Family Therapy, also in support.
Thank you.
Carol Sewell from the California Commission on Aging in support of the bill. We want to thank the author and the sponsors for the inclusion of additional elder abuse provisions in the bill.
Thank you.
Move the bill.
Thank you.
Madam Chair, members, George Miller on behalf of Education Management Corp., the parent of Argosy University, which provides marriage and family therapy educational curriculum.
In support?
Support of the bill.
Thank you. Any other witnesses in support? And this is in opposition. We have a motion. Are there any questions from the committee members? No? It's been moved by Mr. Emerson. Second by Mr. Hernandez. Would you like to close?
Ask for an aye vote.
Thank you.
Motion is due pass to appropriation. Hayashi?
Aye.
Hayashi, aye. Emerson? Emerson, aye. Conway? Conway, aye. Ing? Hernandez? Hernandez, aye. Nava? Nilo? John Perez? Ruskin? Ruskin, aye. Smythe? Hill?
The measure's on call. One vote short.
Thank you, Madam Chair.
Next item, number 9, SB 549.
Thank you, Madam Chair. This is a bill that deals with public safety or health of the safety in the state of California. There are over 114,000 licensed nail technicians and more than 260,000 licensed cosmetologists in the state of California. As you know, this is an industry that is characterized by multi-ethnic, multilingual technicians. over the last year or so, we've held a number of hearings in Southern California to address compliance by the technicians with the applicable rules and regulations regarding the health care. And so what we have before you today is an industry-sponsored bill as a result of dealing with private sector to collect data on language and ethnicity to determine the best way to help the industry comply with the existing framework of laws and regulations.
Thank you. Witnesses in support?
Madam Chairperson and members of the committee, my name is Tina Ling, and I'm from the Asian Law Caucus. We've done a tremendous amount of outreach towards the nail salon community in the Bay Area as well as throughout California. And like Senator Correa mentioned, there are over 114,000 manicurists in California. There's anywhere between 40 to 80% Vietnamese, and that is an unofficial number. The majority of these nail salon workers and owners are limited English proficient, and even a greater majority are females of reproductive age. And during our outreach, we've learned that the number one language barrier is the number one reason why what nail salon workers and owners say in terms of accessing worker health and safety information. So collecting this data will allow the Board of Barber and Cosmetology to target their target audience and provide information, health and safety information in a language they can understand so that they can protect the workers and owners and also the clients that they serve. And there is a trend right now for cosmetology schools to provide education in Chinese, in Vietnamese, and Spanish. And the test itself is provide nail salon students actually can take these tests in Vietnamese and Spanish. But once they graduate from these schools and become licensed manicurist, the information that they receive are mostly in English. So collecting this data will allow the nail salon community to be better informed about the health and safety information. And in terms of ethnicity and gender, like Senator Correa said, a lot of the chemicals that nail salon workers are exposed to are reproductive toxins, developmental toxins, and carcinogens. And it's been well accepted in the scientific community that certain chemicals have metabolizes differently in different ethnicity. For example, toluene, which is a common chemical found in nail care products, are actually metabolized a lot slower in the Asian community. And so the nail salon community, particularly Vietnamese, are impacted by this chemical exposure. So collecting that data as well as the gender information will allow researchers to better develop their methodology and to better analyze the data. Thank you.
Great. Thank you. Next witness.
Leilani Aguinaldo Yi with Asian Americans for Civil Rights and Equality. ACRE is a joint project of Chinese for Affirmative Action, Asian Law Caucus, and Asian Pacific American Legal Center. And Tina has already articulated a lot of the reasons to hopefully support the bill. There is a lack of access to information in a language that workers and owners can understand. And this bill, SB 549, will help these workers be better informed and allow the BBC to more effectively communicate important consumer protection information to these workers, such as current laws and regulations and health and safety standards. So as Senator Correa articulated, this is an industry that is very attractive for new immigrants. So it's very much a very multi-ethnic worker population that covers a lot of different languages. So I strongly urge an aye vote.
Thank you. Any other witnesses in support? Witnesses in opposition? Mr. Emerson, you have a question?
Several years ago, we passed legislation to establish some type of universal precautions for sterilizations and things of this nature. What is the compliance on that with the industry?
Let me just tell you that that is the issue right now that we are addressing because, as I stated earlier, the impetus for this legislation was a result of numerous town halls that we had throughout Southern California because of noncompliance. So you had fines, people just about being put out of business. And after these town halls were put together with the regulators and, of course, the small business people, we came up with not I, but those interested parties came up with this bill idea so that we could collect information to better communicate with those that are in this practice or in this business. It is hoped that once we get the communication going, once we have higher compliance with existing laws and regulations, we have higher standards, or I should say the higher standards will be complied with. And that is the challenge, is compliance with the existing laws and regulations. And that's what we're trying to do right now, sir.
So compliance has to do with the language barrier? Is that why you're requesting this additional?
The data is to determine, what languages are out there spoken primarily, and what is it that we need to do to assure that there's compliance. Now, clearly, if I can read your thoughts, if you come up with 100 languages, clearly...
Yeah, big trouble. Thank you.
But this legislative work, is merely to give us some data to come up with a better framework to increase compliance, simply.
Thank you. No. Oh, Ms. Conway?
Thank you, Madam Chair. I think what I'm trying to understand is just the people, they already take the test in different languages, so you already know what languages they need the information in, or that's the part that I worry about. I mean, on the surface, I get it. I understand, what you're doing. It's just, personally, it's almost like, oh, it sounds like we're targeting people, or we're trying to put them on some kind of list or collect data, and that always makes me...
I couldn't agree with you more. Targeting people, it shouldn't be the role of government in any way, form, or manner. What we've done here is trying to collect some data to determine whether there's a better way for the regulators and the small business individuals to communicate compliance, simply stated. And again, this wasn't Lou coming up with a solution. Rather, this was the small business nail salons and the regulators saying, these are the problems, these are the challenges. What's the first step towards addressing compliance? And the first step is, well, let's find out if there's any communication issues that we have overlooked. And what this bill does is permits the regulators to collect this data of people renewing their licenses and to see whether there's anything else we can do there. Just give us more information, and it's all voluntary.
So the tests are already offered in languages?
Vietnamese and Spanish and English.
But the health and safety information isn't available in?
Predominantly, no, it is not. It is only in English. So you begin to see a disparity here.
Yeah, or just offer the, whatever language you're taking the test in, offer the health and safety information in that language.
Okay, do we have a motion on the bill?
Sorry.
No, that's a very good point, Ms. Conway.
Thank you, Ms. Conway. Is there a second? Thank you. Would you like to close?
Ask for an aye vote.
Thank you.
There was no opposition testimony.
Motion is due pass to appropriation. Hayashi?
Aye.
Hayashi, aye. Emerson? No. Emerson, no. Conway? Ng? Ng, aye. Hernandez? Aye. Hernandez, aye. Nava? Nava, aye. Nilo? John Perez? Ruskin? Ruskin, aye. Smythe? Hill? Hill, aye. 16.
Your measure's out. Thank you, Senator
very
Correa.
much, Madam. Thank you, honorables.
Thank you for visiting us. Senator Flores will take you next. Item number 7, SB 392. Welcome.
Thank you, Madam Chair. Appreciate the courtesy. Members, I'll be very brief. SB 392 authorizes the issuance of contractors' license to limited liability companies. It requires contractors, LLCs, to maintain specific amounts of liability protection, and it makes other conforming changes. The bill has had no opposition at this point and got through the Senate with no votes, and we do have witnesses of support.
Madam Chair, members, Paul Gladfelter representing the Associated General Contractors of California and AGC of San Diego. We're the sponsors of this bill. It's principally designed for accounting purposes. It's not, even though it's a limited liability company, if you wanted to shield liability, it would be under the subchapter S or a C corporation. So the benefits of this bill is really to assist businesses, especially at a time like now where the economy's down and businesses are being passed on to their children and so on. And so we believe that this bill would be important to pass, and it is allowed in 28 other states in which there are licenses required for contractors. So we would ask for your aye vote.
Thank you. Any other witnesses in support?
Very briefly, Madam Chair, Park Terry, representing the California Landscape Contractors Association. This is a very important bill. We've worked on it for, I think, 2 or 3 years now to try and get it right. It is right now. Your analysis is right on target, and we strongly urge your aye vote.
Thank you.
Move the bill.
Thank you.
Madam
We have
Chair,
support on both sides.
Phil Vermeulen, engineering contractor, strong support. Thank you.
Thank you.
Thank you, Madam Chair. Todd Bloomstein, Southern California Contractors Association, support.
Kevin Pedrati, representing the Engineering and Utility Contractors Association. In support.
Thank you. Any witnesses in opposition? Questions from the committee members? Yes, Ms. Conway.
Thank you, Madam Chair. Not really a question, Senator. It's all right. He'll finish in a minute.
I'm sorry.
It's okay, Senator. It isn't even really a question. I had a conversation a couple of weeks ago just with a lawyer who had seen a lot of things coming through, and he said, this is a glitch. You know, this needs to be fixed. So I'm maybe just voicing my jealousy that actually you thought of it before I had an opportunity to bring it forward. But as I say, that I think the community is well aware, because they're at least the legal community was, questioning me and saying, why is this like that? So just thank you.
Thank you. Thank you.
Okay, no questions. We have a motion and a second. Would you like to close?
Would ask for an aye vote.
Thank you.
Thank you.
Please call the roll.
Motion is due pass to Judiciary. Hayashi?
Aye.
Hayashi, aye. Emerson? Aye. Emerson, aye. Conway? Conway, aye. Ng? Ng, aye. Hernandez? Hernandez, aye. Nava? Nava, aye. Nilo? John Perez? Ruskin? Ruskin, aye. Smythe? Smythe, aye. Hill? Hill, aye.
Your measure's out. Thank you.
Thank you, Madam Chair, for the courtesy as well. Thank you, members.
Mr. Calderon, thank you for waiting. I believe you have 2 bills. Item number 2, SB 109. Item 5, SB 237. Which one would you like to take up first?
109.
Okay, thank you. Welcome.
Thank you so much, Madam Chair and members. This morning I bring you SB 109, which enacts changes intended to protect consumers who bid at auctions of a real property, which is pretty common nowadays, unfortunately. These auctions are targeted by this bill. We're targeting the large ones that are held in convention centers and other large venues throughout the state where hundreds of foreclosed properties are auctioned off on the same day. At the same time, California lacks any laws that protect consumers who bid at these auctions. So what SB 109 will ensure is that people who do bid at the real property auctions, number one, have a very clear understanding of the terms of those auctions and are able to get their refundable deposits back in a reasonable period of time if their bid is not accepted by the seller property. That's why I'm here today, to ask for your aye vote, and we do have a witness that would like to testify in support.
Okay, thank you. Thank you.
Madam Chair and members, Mike Belote for the California Escrow Association. These transactions are kind of complicated between the lender, seller, escrow, and we wanted to thank the Senator and his staff for working out the complicated transaction to make sure that, in fact, buyers who are not going to get the property have the right language in the law to get their money back. So it's properly crafted, and we'd like to thank the Senator.
Thank you. Any other witnesses in support? Opposition? I think we have a motion and second. If there are no questions. Mr. Calderon, would you like to close?
Ask for your aye vote.
Thank you.
Motion is due pass to Judiciary. Hayashi?
Aye.
Hayashi, aye. Emerson? Conway? Conway, no. Ng? Ng, aye. Hernandez? Hernandez, aye. Nava? Nava, aye. Nilo? John Perez, Ruskin. Ruskin, aye. Smythe. Smythe, no. Hill. Hill, aye.
6 to 2, your measure's out. Next item, number 5, SB 237.
Yes, thank you, Madam Chair. I'd like to begin by offering up the amendment discussed at the top of page 5 in your analysis.
What's that? Okay. Thank you.
Okay. Just wanted to give you time to absorb that. SB 237 will create a registration program for appraisal management companies within the Office of Real Estate Appraisers and would establish certain prohibited acts by the AMCs. The bill is intended to ensure the integrity of the real estate appraisal process. Action on AMC regulation this year is extremely important because the AMC industry is expected to grow significantly in response to new rules put into place by Fannie Mae and Freddie Mac. At present, California doesn't regulate AMCs, which creates a consumer protection void in the appraisal process. SB 237 will fill that void, and it is a consensus bill with no opposition. I have Mr. Belote here to testify on behalf of the bill's sponsor, the Appraisal Institute, and I do ask for your support today on this measure.
Thank you.
Madam Chair and members, just very briefly, Mike Belote for the Appraisal Institute. This bill responds to what's really a sea change in how real estate appraisals are done. For decades, the basic model was lender-ordered appraisal and selected an appraiser to do the work. What has happened in response to the subprime crisis and changes in federal law and regulation is we've created a whole new middle class where the appraisal is actually ordered, done by the lender to the appraisal management company, who in turn selects the appraiser. But that gap, there's nobody that knows who these appraisal management companies are if they've been revoked as licensed appraisers, for example. This is a narrowly targeted bill that basically identifies who the AMCs are, gets them in front of the Office of Real Estate Appraisers, and indicates some basic prohibited acts, including coercing or pressuring appraisers to inflate values, hopefully preventing the same kind of problem we've had in recent years. We worked real hard with the appraisal management community to make it as narrow, tight, crafted bill as possible, and we'd ask for your aye vote.
Thank you. Any other witnesses in support?
Neutral? Accept that. George Miller on behalf of HSBC. We just want to appreciate the opportunity of working with the Senator and his staff and the proponents of the bill over the last several months to craft something that we think we can all live with. Thank you.
Is that support?
Was that neutral?
Any witnesses in opposition? Any questions from the committee members? I think we have a motion and second.
Right.
Oh, no, we need a motion. Thank you. Thank you. Would you like to close?
Ask for your aye vote.
Thank you.
Motion is due pass as amended to appropriation. Hayashi?
Aye.
Hayashi, aye. Emerson? Conway? Conway, no. Ng? Ng, aye. Hernandez? Hernandez, aye. Nava? Nava, aye. Nilo? John Perez? Ruskin? Ruskin, aye. Smythe? Smythe, aye. Hill? Hill, aye.
7-1, your measure's out.
Thank you very much,
you.
Madam Chair. Members.
Welcome, Ms. Wiggins.
First, I'm presenting SB 620, osteopathic doctors. Madam Chair and members, SB 620 seeks to assist the healthcare community to address the primary care physician shortage. This would be done by providing information on the practice of osteopathic physicians and surgeons through the form of a relicensure survey. I would like to accept the suggested technical amendments in the committee analysis. Specifically, on page 1, line 5, delete license renewal and add initial licensure. And on page 2, line 15, add initial licensure. These amendments clarify the information about medical specialties and cultural background may be taken upon initial licensure and upon licensure renewal. This bill has no opposition and is sponsored by the Osteopathic Physicians and Surgeons of California. I have Tom Riley here to testify in support of the bill and to answer any questions the committee may have.
Thank you, Senator. Welcome.
Well, thank you. Madam Chair, Tom Riley with Osteopathic Physicians and Surgeons of California. This is an important bill because MD physicians are doing this now at the time of their biennial licensure and at the time of initial licensure. This is providing information on language, on cultural background, on the kinds of practices that they are in, and other things that help the state get a handle on whether we have the right physicians in the right places to provide the kinds of services that the state desperately needs. This simply expands this to the Osteopathic Medical Board. It provides the information at the time of biennial licensure by DOs in the state to the Office of Statewide Health Planning and Development. Urge your support.
Great. Thank you. Any other witnesses in support? Opposition? Mr. Emerson, you have a question?
Yeah, Mr. Riley, what do you mean by the right person at the right place?
Good question. The right person at the right place is one that can address the health care needs. California, as you know, is the most diverse population in the country. And there are rural needs, there are inner city needs, there are needs of women have different needs than men have for health care. And in communities that are medically underserved, that have a particularly high volume of people who have diabetes or other chronic conditions, they need the kinds of primary care physicians that will be attentive to their physical and by the way, developmental and mental health needs as well.
I agree with all those things, but what does that have to do with cultural background?
Sometimes we have another client as well in our office, which is the California Healthcare Interpreting Association. We don't lobby for them because they're a 501c3 organization. But one of the things we do for them is we go out upon request to hospitals that ask to have a language survey. And it's not just language, it turns out. It's also the ability to identify cultural issues in healthcare that is so important. Things can be missed, and one of the things we've learned from doing these surveys at different sites is things are missed, and there are near misses. And to know who in your healthcare provider community has those skills can be tremendously important for the health and well-being of patients.
Dr. Hernandez.
Senator Wiggins and Mr. Riley, I want to commend you for bringing this bill forward. I understand that it is a mandatory upon biannual renewal. Is that correct? Okay. And is there, I know this is a policy committee, but in appropriations on the Senate side, how was it keyed physical and what was the cost? Is it going to be done through dues or is it going to be done through, will they be able to absorb it through the agency or through its prospective board?
Before introducing the bill, we had that discussion with the Osteopathic Medical Board and with the Office of Statewide Health Planning and Development, and we believe that, in fact, they can absorb the costs within their existing.
There won't have to be any increase in annual renewal of the applications or the licenses then?
No, they're actually in a separate bill, which Senator Ducheney is carrying. There is an increase of $25 in the biennial licensure fee. For the purpose of providing loan repayment to osteopathic medical students who go into the Steve Thompson loan repayment program, but not for this.
Okay, and are the questions going to be mirror that of a physician when they do their, because I know it's physicians and nurses are the only ones that are currently required to collect that data. Is it going to be similar to those two entities or more aligned with physicians?
Yes, we're trying to align it with the information currently required by physicians. Dr. Kevin Grumbach at UCSF has given a number of presentations to the legislature on what we now know that we didn't know even 5 years ago from the MD biennial licensure survey. We want to emulate that survey in this bill.
And this information would just go in perfect with the strategic plan that hopefully the state's going to be very soon to look at where the health workforce is going to be going. Is that correct?
Yes.
Okay, great. Thank you.
Dr. Emerson, again.
Who determines the right place?
You do.
And the right person.
I think you do. The information is that this information should be of value to the legislature in making those determinations.
Okay. I'm a healthcare provider, and we all go through the same training, and we're trained to be sensitive to needs of various patients that come into our office. And I know other professions are trying to do this, and I'm encouraging my professional organization not to do this because I don't think it's necessary. And I'm concerned when there's only a couple of people who have medical backgrounds in the legislature determining who the right person is in the right place.
Indeed, I hope you understand that the point of this is to have information to provide you with the best possible information to make the right kinds of decision about health workforce deployment in the state, not to coerce medical students or to direct people into areas that they are not interested in.
I'll move the bill.
Thank you. Thank you. Senator Wiggins, would you like to close?
Yeah, I asked for an aye vote.
Thank you.
Motion is due pass as amended to appropriation. Hayashi?
Aye.
Hayashi, aye. Emerson?
No.
Emerson, no. Conway? Conway, aye. Ing? Ing, aye. Hernandez? Hernandez, aye. Nava? Nava, aye. Nilo?
No.
Nilo, no. John Perez? Ruskin? Ruskin, aye. Smythe? Smythe, aye. Hill? Hill, aye.
8 to 2, your measure's out.
Thank you.
Now we will take up item number 6, SB 260.
Yes. Thank you. Okay, this is SB 260, and it's Assembly. Susan Boyd is the chair, and it's Madam Chair and members. Currently, each of our county's agricultural commissioners, in concert with the state's Division of Measurement Standards, are responsible for inspection and testing of petroleum and automotive products for quality standards. This program is funded by a 2-cent per gallon assessment on motor oil. The cap has not been increased in 29 years. The revenue is not kept up with the cost of the existing program. SB 260 will increase the cap to 5 cents to cover the cost of administering the current program. I would like to turn this over to the sponsors for comments.
Thank you. Welcome.
Madam Chair, I'm Frank Carl. I'm the Sacramento County Director of Weights and Measures, and here today representing the California Association of Ag Commissioners and Sealers. We are sponsoring this legislation on behalf of the Department of Food and Agriculture's Division of Measurement Standards. This bill would increase the fee cap to 5 cents. The division expects to promulgate regulation which would increase the fee initially to 4 cents, which would double the fee. It hasn't been increased in 29 years. This would be 1 cent per quart of oil. The funding provides support for the entire program, and I urge your aye vote.
Great, thank you.
I have David Lazier here with me today who can answer technical questions. He ran the program for a number of years at DMS.
Great. Any other witnesses in support? Witnesses in opposition? Any questions from the committee members? Hearing that, oh, you have a question, Ms. Conway?
Just full of questions today. Thank you, Madam Chair. I just want to understand, it says the cents, whatever the cents are, to whatever's bought or sold. So is it an increase in the fee when you buy it, and then there's also an increase in the fee for the person buying it as it's sold, or?
No, the fee is only applied one time, typically to the manufacturer of the product when they deliver it to a retail sale in the state.
Okay, because when I read it, it said bought or sold. So I wasn't sure if that meant it was
Well,
when you buy it and when you sell it.
if the oil's produced in California, the manufacturer pays the fee when he sells it. If the person imports it into California, when they buy it out of state, they pay the fee.
Okay, so that clears it up a little bit for me. Thank you.
Okay, I think we need a motion. Would you like to close, Ms. Wiggins?
Yeah, I asked for an aye vote.
Okay, thank you. We need a motion, please. Second by Jerry Hill.
Motion is due pass to appropriation. Hayashi?
Aye.
Hayashi, aye. Emerson? No. Emerson, no. Conway? Conway, no. Ing? Ing, aye. Hernandez? Hernandez, aye. Nava? Nava, aye. Nilo? Nilo, no. John Perez? Ruskin? Ruskin, aye. Smythe? Smythe, no. Hill? Hill, aye.
624, your measure's out.
Thank you.
Thank you. Senator Padilla, welcome to BMP. We are going to take up item number 8, SB 475.
Yes, thank you very much, Madam Chair, members of the committee. SB 475 will allow the California State Board of Guide Dogs for the Blind to raise the current fee cap that's been in place since 1994. Since 1994, the workload, frankly, has doubled. And between the doubling of the workload, the fee cap that's been in place, it's put the board in the position, according to the Department of Consumer Affairs, to be fund deficient by the fiscal year 2012-2013. So raising the current statutory cap will grant the board the needed ability to raise funds and, along with some flexibility, to continue to carry out their critical licensing and oversight functions. Specifically, the bill would allow the board to raise the current fee cap from 0.004 or 0.4% to 0.005, 0.5 of 1%. The bill is sponsored by the board and is supported by the California Council of the Blind, Guide Dog Users of California, Guide Dogs of America Training Schools, and has been approved by the Senate, both in committee and on the floor, unanimously. Ask for your aye vote.
Great, thank you. Witnesses in support.
Good morning, Madam Chair and members. My name is Antoinette Sorick, and I'm here representing the State Board of Guide Dogs for the Blind. And just wanted to include that by supporting this bill, that you ensure that we continue licensing schools and maintaining standards of training for guide dog instructors. Thank you.
Thank you.
Madam Chair, this is Frank Welty. I represent the California Council of the Blind and also the Guide Dog Users of California, and we support this bill.
Thank you. Any other witnesses in support? Any witnesses in opposition? Questions from the committee members?
Move the bill.
Thank you. Thank you. Would you like to close?
Ask for aye vote.
Thank you.
Motion is due pass to appropriation. Hayashi?
Aye.
Hayashi, aye. Emerson?
Aye.
Emerson, aye. Conway? Aye. Conway, aye. Ing? Ing, aye. Hernandez? Hernandez, aye. Nava? Nava, aye. Nilo? Nilo, aye. John Perez? Ruskin? Ruskin, aye. Smythe? Smythe, aye. Hill? Hill, aye. 10 to 0.
10 to 0, your measure's out.
Thank you very much.
Thank you.
Thank you.
Thank you. Maybe we can adopt our consent calendar. I believe we have 2 items. Item number 3, SB. I'm sorry. Item number 4, SB 171. And item number 11, SB 760. Is there a motion?
Move it.
Thank you. Please call the roll.
Hayashi.
Aye.
Hayashi, aye. Emerson.
Aye.
Emerson, aye. Conway. Conway, aye. Ng. Ng, aye. Hernandez. Hernandez, aye. Nava. Nava, aye. Nilo. Nilo, aye. John Perez. John Perez, aye. Ruskin. Ruskin, aye. Smythe. Smythe, aye. Hill. Hill, aye.
11-0. We also have a bill on call, I believe. Item number 1, SB 33.
Ng. Ng, aye. Nava. Nava, aye. Nilo. Nilo, aye. John Perez. John Perez, aye. Smythe. Smythe, aye. Hill. Hill, aye. 11-0.
11-0. That measures out. I believe we only have 1 item left. Item number 3 has been pulled. Oh, so we're done? Great. Yes, we did that.